All right, thank you very much, Patrick. Well, in rural America, getting health care can be difficult, and for some people, it means going out of their county just to see a specialist.
But health systems are doing what they can to provide services through facilities. In part 2 of our exclusive series, we look at the progress and struggles in providing a means to living healthy in rural America. For 28 years, Dr. Beth Cassidy has practiced in Spring City. It's a town with a population of around 1,800.
I go to church with my patients. I see them in the grocery store. I see them in the dollar store.
She grew up in a small town and made this one her home after residency.
I used to deliver babies when I first came here for the first 4 years that I was here. So I'm seeing the children that I deliver children now. And I'm seeing the grandchildren of the people when I first came here. I'm seeing their grandchildren here in practice, and that means a lot.
Many rural areas don't have needed health care, so Dr. Cassidy fills that void. But it comes with taking on not always typical family practitioner tasks.
We try to do everything that we possibly can, because a lot of patients do not have the transportation to go somewhere else. And if they have the transportation, a lot of people are scared to drive in a larger city.
The Erlanger Western Carolina Hospital serves Cherokee, Clay, and Graham counties. In August, they opened a facility with extended hours in Hayesfield, North Carolina. Since it opened, visits have increased 82%, but it still may not be enough. CEO Mark Kimball says there's still a lack of doctors in those counties.
And the lack of primary care physicians is tremendous. There is a deficit of 21 primary care physicians.
While certain programs often offer incentives for doctors to practice in rural areas and facilities sometimes rotate specialists from out of town, Kimball says recruitment is always a challenge, but they're seeing success.
We have to target physicians that want to come and live in a rural community. They're going to see patients whether they live in rural communities or live in a metropolitan area. It really starts to boil down to the quality of life and what they're looking to do after work.
According to UNC Center for Health Services research, over the past 6 years, 3 rural hospitals in our area closed. But in Sequatchie County, things are getting better. 5 years ago, Erlanger opened an ER. Then the county's health status was ranked near the bottom of the state's 95 counties. Now it's ranked 33rd.
We really increased access to health care for the folks of Sequatchie County when we opened that ER.
As for Dr. Cassidy, while being a well-rounded doctor, she still sees struggles in her area and getting care for people who cannot travel.
I'd like more of a cardiology presence, nearby.
So while strides are being made when it comes to rural health care, more work needs to be done.